Okay, distinguished guests, ladies and gentlemen, today I am Andy Yan, the MC for this virtual seminar. Welcome to this virtual seminar hosted by Taiwan Adventist Hospital and the Ministry of Foreign Affairs. This seminar aims to provide a platform for experts from both Taiwan and North America to share experiences on COVID-19 prevention. So first, let me go over some of the ground rules for this seminar. We have collected your questions submitted before, which will be answered throughout the seminar. If you wish to ask additional questions regarding the presentations during the Q&A session, please click the chat button and submit it onto our Microsoft Teams platform. Our moderator will answer the questions accordingly. Due to the time constraints and the number of participants, we might only open up the floor for a few questions. Now, I would like to invite Deputy Foreign Minister Dr. Si Jianxu to offer his opening remarks.
Dr. Huang Huiting, the President of the Taiwan Adventist Hospital, the Honorable Boris Leon Guerrera, Governor of Guam, the Honorable Ralph Elian Guerrera Torres, Governor of the Commonwealth of the Northern Mariana Islands, distinguished guests, ladies and gentlemen, good morning. I would like to express my gratitude to the Taiwan Adventist Hospital for making this webinar possible. It is an honor to have Governor Guerrero of Guam, Governor Torres of the Commonwealth of the Northern Mariana Islands, and other distinguished guests with us today. We may be an ocean apart, but we are all in the same boat with regard to tackling the coronavirus pandemic. Thanks to Taiwan's previous experiences with the SARS in 2003 and the hard lessons we learned from it, we have been well prepared and therefore particularly adept at tackling the COVID-19. We're pleased that our success has been acknowledged by the international community, and we are ready and more happy to share with the world. The United States was one of the first countries to seek cooperation with Taiwan. To further strengthen our collaboration, on March 18th, Taiwan and the United States issued the Taiwan-US Joint Statement on a partnership against coronavirus. Both sides have agreed to share vital medical supplies and equipment, as well as facilitating cooperation on the research and development of rapid test kits, vaccines, and medicines. Furthermore, in the spirit of Taiwan can help and Taiwan is helping, President Tsai announced 2 rounds of humanitarian aid in April, donating 17 million medical masks to the United States, the European Union, new southbound policy partner countries, and our diplomatic allies for distributing to their frontline medical personnel. And just yesterday, Taiwan announced a 3rd round of medical mask donations, which will include Guam and Commonwealth of Northern Mariana Islands. Despite Taiwan's success, we are unfortunately excluded from the World Health Assembly, and often even from the WHO working level meetings. This not only violates the health rights of Taiwan's 23 million people, but also creates a dangerous gap in the global health system, putting the whole world at risk. As the COVID-19 pandemic continues to ravage the world, this year's WHA will likely be held as a webinar, which in theory would facilitate Taiwan's participation. And given our current success in combating the pandemic, there is really no reason why Taiwan should not be invited to participation in WHA discussion on COVID-19. The Taiwan model has proved to the world that transparency and accountability help build stronger trust between the government and its people. Taiwan will continue to work with the United States, our diplomatic allies, and like-minded nations to safeguard the health and well-being of the international community. I would like to thank you again. I know today there are participants not only from Guam and the Northern Mariana Islands, but also from Hawaii, California, the Washington State, Washington, D.C., and even Toronto. We thank you for your participation and welcome you all. I hope you have a fruitful and engaging discussion ahead. Please enjoy the seminar. Thank you.
Thank you, Deputy Foreign Minister Xu. Now I would like to invite the President of Taiwan Adventist Hospital, Dr. Huang, to say a few words.
Good morning, Deputy Minister of Taiwan MOPA, Dr. Xu, and Director General, Mr. Yao, Governor of Guam, Mrs. Guerrero, Governor of Saipan, Mr. Torres, our distinguished guests, and ladies and gentlemen. I hope this video finds you well. Good to see you at the seminar. I'm so glad to see many friends at Guam and some new faces on the screen. It's a very special way to renew acquaintance and making friends as well. It has been a lapse of 4 months since we visited Guam in January this year. At that time, there's only a few sporadic cases in China. But nowadays, the coronavirus has been devastating the world and changed the world and impact the world in terms of health and economy. Most of us didn't know how to cope with the outbreak in the beginning. I know it's a difficult time for us. We are facing a tremendous challenge amid the coronavirus pandemic. Although the outbreak distanced us, our hearts are closer than ever before. Together we can prevail over the virus. The purpose of the meeting aims to share experience with each other and to see how we can help. First, we will show you what we have been doing to contain the virus spreading in the hospital. Additionally, what measures we have taken to support and encourage the frontline workers during the difficult time. As you know, so far, Taiwan there have 438 confirmed cases reported with 6 days. It has been flattening the curve in Taiwan. I'd like to stress before the meeting, Taiwan model may not fit all situations perfectly. However, we can give you tips at large to stop the virus. We are waiting for the promising medical development in the future. Ultimately, it can exterminate the virus. Here, I'd like to thank Taiwan Ministry of Foreign Affairs to coordinate the meeting. I also appreciate your attendance from so many places in USA. I wish the success of the meeting and rich harvest for you. May God continue to bless you. Thank you. Thank you.
Thank you, President Huang. Now, I would like to invite the Governor of Guam, Lourdes Leon Guerrero, to say a few words. Governor, can you open your microphone?
Yes. Good morning for us. I don't know if it's the same for you. And I just wanted to begin by thanking the Taiwan Adventist Hospital for really putting up this conference. I think it's very important that we in this Asian Pacific regional area get together to learn from each other what best practices maybe we can all take away to better prepare and better prevent this coronavirus. I'd just like to thank Dr. Huang, President of the Taiwan Hospital, for his leadership in making this happen. And nice to see you again. And I still really want to visit Taiwan, but maybe after this whole coronavirus, and we can get together and have a few Corona beers instead. I also have Dr. Mike Cruz with me. Dr. Mike Cruz is my medical advisor. He is the Surgeon General State Surgeon General for our coronavirus team, and he has been very instrumental in advising me to be informed and to be able to make the right choices and the right decisions for our people. I have also been tracking the coronavirus since December of last year, along with my public health director. And of course, when it started getting hot, we also were looking at what can we do to help prevent it from coming. So we had acted very quickly. We had acted very aggressively. In a matter of 1 week, we declared a public health emergency. We closed schools. We closed senior centers. We closed government only for essential people. So we did everything that Taiwan did. I understand that Taiwan has been seen as the leader in this whole coronavirus because for a population of 23 million and to only have 430 confirmed cases and 6 deaths, that is amazing numbers, I think, to tout out there in the whole area of public health throughout the whole global world. So we are looking very closely at what you have done, and we look closely at what South Korea has done, and we instituted. The beauty of our Guam is that we were able to do it very proactively, very decisively, and using, like I said, very aggressive and very conservative measures. And so I think because of that, and because we set up the structures in place that would really also help us along the way, we had public health experts with us, even communicating very closely with the CDC and the World Health Organization, and getting all the information and meeting and deciding and then proclaiming through executive order the measures that we are going to be doing. So right now, if you're tracking our numbers, we are really actually only have about 150 confirmed cases and only 5 fatalities. We are not including the numbers from the USS Theodore Roosevelt, because the Navy has its own unit, and the Navy has its own agency or entity that tracks all of their cases through the naval military groups. So we're not including them in these numbers. However, CDC includes them because when they make the whole United States numbers. So our numbers have been really contained. We have been in the low end. We are now doing more expansive testing, although we are very concerned about our supply and inventory. But even by expanding the testing of our community, we are still seeing very, very, very low numbers. So by May 11th, we are going to be reopening slowly again, because we've seen where countries that open real quickly had to kind of reverse what they've done because they saw an increase in COVID cases. So we are learning from them. So what we're doing is we're going to be lifting some restrictions, and together with lifting the restrictions, we're going to continue testing, and we're going to continue monitoring very closely, because if we start seeing any increase in the cases, we would have to rethink our strategy and again go back and institute more measures. I just really believe this crisis is going to be longer than what everybody, than what we think, and we cannot be complacent. We cannot let our guards down by just looking at our numbers. We need to make sure that when we institute our measures, that we are controlling the risk that we have agreed to accept by putting in the mitigation, which is testing and contact tracing. That's very key, right? We all know that. You guys are all doctors, that you need to look at the cause of the situation and remove the cause. And if the cause is a positive person, you remove that positive person out of the community, you isolate them, and then you follow the contacts of those positive people. So we all know that. Very basic epidemiology, very basic contact tracing. And there's no big magic about it. We just have to really be very diligent, be very persistent. I am getting a lot of pressure from a lot of the business people to open it right away. But I'm saying, no, you can hate me if you want to, but I want to make sure our people are safe and that we don't have any more fatalities. So I am faced with a lot of criticism, but I'll tell you, I know that what I'm doing, I know that what we're doing is the right thing. And that's what's guiding us, right? The right thing. And we are very sure that what we're doing is the right thing, even though this virus is so uncertain and this virus is not well known among the scientists. But as we move forward, we will learn more about this virus, and hopefully we can come up with a vaccine. And I'm pretty sure, President Juan, that your people, your scientists are also looking at what we can do to treat it in a much more permanent way so that we can protect our people from the virus. So I'm looking forward to listening to what all of you are doing in your areas. And I just want to, if you see President Ing Wen, please congratulate her for me for being reelected. And also, please congratulate her for her persistence and her insistence also, and her big, adamant and strong, brave actions to protect your people. Thank you, and thank you again. Thank you so much for allowing me to speak and for inviting me to this conference.
Thank you very much, Governor. Next, I would like to invite the Governor of the Commonwealth of the North Mariana Islands, Governor Torres, to say a few words.
Day, Tiro, and good morning. I hope all of you are staying safe and healthy. With this conference, we have, I'm honored to inform that in this seminar, we have our Commonwealth Healthcare Corporation CEO, Esther Muña, our COVID-19 Task Force Chair, Warren Villagomez, and my Chief of Staff, Angel Dimapan. I want to thank Dr. Wang, President of Taiwan Adventist Hospital, and Dr. Joseph Wu, Minister of Foreign Affairs, for co-hosting this seminar on Taiwan's COVID-19 prevention experience sharing. I am eager to listen to the experiences and successes of Taiwan's policy and response to counter the COVID-19 pandemic. Here in the CNMI, the Marianas Islands, it has been a long couple of months for us, and I know it's been hard for everyone. This virus has taken a toll on our islands, both physically with our health and economically with our budget shortfall, and emotionally with our lives. Our islands, fragile as they are, the rest of the world have been devastated. No one could have predicted we would be in a situation like this. We are living in an unprecedented times as we combat two crises, a global pandemic and economic downturn. But there are a lot of good people doing good work during our COVID-19 response. Our executive team, together with our doctors and nurses, medical workers at CHCC, and our cadre of first responders, have been hard at work to contain the threat of this pandemic as best we can. Over the last several weeks, our COVID-19 task force and the Commonwealth Healthcare Corporation have increased our healthcare capacity through our new field hospital and alternate care site at Kanoa Resort, upgrading our hospital laboratory, and most recently, we launched our community-based testing operations. Through this strong partnership with FEMA, the U.S. Department of Health and Human Services, and the Department of Defense, our 40-bed medical care treatment facility has been opened, while the alternate care site at Kanoa is scheduled to be operation in mid-May, which is a couple of weeks from now. It is my hope that we never have to use these facilities, but we will continue to be proactive by preparing for the worst case scenario should our case increases. Our goal is to test everybody, but we know that our most critical priorities are hospitalized patients and healthcare facility workers, our senior citizens and our people with underlying medical conditions, our first responders, our government employees providing federal assistance, and essential workers at stores and other critical services. We have established a scheduling and registration process to ensure that we can carry out this goal. Our government is doing everything it can do to contain this virus by working with our federal partners, our local and international partners. Right now, healthcare precedence over anything else. We have to make decisions based on only what we believe is right. This pandemic is filled with unknowns, but what is the aggressive response effort we are taking to flatten the curve? As far as our team conducts mass testing for our community, we must keep our guards up until we defeat this disease. Today, I am grateful for this opportunity to hear from a place with a world-class healthcare system, a proven record of successful responding to a pandemic of this magnitude. Given the continual spread of COVID-19 around the world, it is important for us to understand the actions that we implement in Taiwan, that were implemented in Taiwan, and the effectiveness of these actions in preventing a large-scale epidemic. Taiwan in a strong position today. My people of the Commonwealth and I desire to be in that same position. I am hopeful that we can achieve the same accomplishments from the tools and resources we can take away from this webinar. Again, thank you for this wonderful opportunity to network and learn from each other's experience. Thank you, Ms. Maki and Dr.
All right, thank you, Governor.